Good morning, everyone, and welcome to this Gemba 360 legal update around the three-stage roadmap and legal compliance obligations for community services organisations. My name is Nihal Samara. I'm the General Counsel and Legal Director of the law firm Kaizen Synergy. I'd like to welcome you all to today's session. As always, we'd like to pay our respects to the elders past and present upon the lands on which we all meet. While this session is being run by webinar, we do pay our respects to the traditional owners. So let's have a look at the agenda for today's session. What we are going to look at is the roadmap that the Prime Minister Scott Morrison has obviously outlined on Friday last week, and that will be obviously the centre of today's discussion and session. With that, we are also going to look at the underlying principles, what the legal context of this actually is, what it means for your agency in terms of taking that roadmap and developing a COVID-safe plan that your agency needs to look at, and what that actually means. Obviously, there are a number of areas that need to be unpacked from that. There are obligations, legal compliance obligations that your agency has around work health and safety requirements, obviously fair work areas that you need to consider, and how and what impacts this has. Over the course of the last few weeks, we have also received a few inquiries around one specific question, and that was around, can employers actually require staff to download the COVIDSafe app, which the Commonwealth has been pushing out over the last few weeks now. And we'll also address that in today's session too. One of the other areas that we've also will look at is there is obviously variation between the states and territories, and it's been described as the three-stage roadmap as a bit of a menu for different states to actually take on or roll out. So for agencies that sit within each state or territory, obviously the directions are coming from the state health ministers and premiers on these particular menu of what they're actually doing, and we'll look at a number of these as well. But in saying that, there is quite a bit of discussion with agencies that either sit on border towns, where they border between Victoria and New South Wales, for example, or New South Wales and Queensland, or alternatively, those agencies that actually provide services across a number of states as well too. And your agency, that we can see there's a huge number of agencies that are joining us this morning, and your agency would clearly fit into one or many of those particular categories as I just previously mentioned. So let's actually have a look at walking through the underlying principles and going through this roadmap, and then also looking at what do we mean by the COVIDSafe Plan. You may already have seen that in making references throughout the roadmap document and your obligations. Some of you may have seen that, this may be very new to some of you, and we'll actually have a look at that. One of the other areas that we'll also briefly touch base on is around some of the current rules that are also in place, particularly touching on the Tenancy's Code of Conduct and what that means now that things are starting to be so-called rolled back. As we go through, happy to field questions that you might have. You can certainly either raise your hand or you can post questions in the questions panel, and we will get to those. Alternatively, we always record these sessions all the way up to the question and answer session, part of the session where we do open up the phone lines and audio lines, and at that point we actually stop the recording as well. So with it, let's move forwards with this. So effectively, the underlying principles that we're looking at still include that Agencies and staff and personnel are required to maintain a 1.5 metre distancing and also good hygiene. We'll have a look at what good hygiene means from a WorkSafe point of view. It also requires that one of the overall underlying principles is that people should be staying at home. And what we mean by this, obviously, is that if you are unwell, not just presenting with possible coronavirus symptoms, that you should stay at home, particularly if you have flu-like symptoms or you have any other illness or unwell, in order to maintain a, I'm going to say, clean and safe environment at the workplace. It also means that it is required that areas are frequently cleaned and disinfected around communal areas, and that your agency starts to develop a COVIDSafe plan for the workplace and premises, and also look at developing this in line of the three-step process that the Commonwealth has recently issued. As part of that, what we have already done within Gemba is to load some of these resources into your Gemba 360 dashboard, many of which agencies are already using those. Some of those is the daily assessment COVID form that many agencies have required that staff complete each day. A number of agencies have also tailored those particular forms that we have put up there to actually monitor further requirements that they've wanted staff to actually complete before showing up to work as well. In terms of the COVIDSafe plan, under the disaster section, you do have a register of the key COVIDSafe plan items that I will also cover off in this morning's session as well. So certainly the Gemba 360 dashboard resources are there for your agency to use. I will also cover off some of the WorkSafe forms and ComCare forms to make it easy for your agency to have a single point of contact for audit requirements as well. So in terms of the overview of the steps, and this is information that many of you would have seen from the Commonwealth guidelines as well. So to step through the steps, step one is the most important step, and it's the smallest step of all, which looks at ensuring reconnection with friends and family and allowing groups of people to be together in homes and also in the community. And this will start to affect, obviously, group classes that your agency might run, and also congregation within the workplace itself as well. As we go through step two, and I'll discuss some of the policy impacts around this, step two looks at slightly larger gatherings and more businesses reopening. There's obviously a higher risk of activities that have tighter restrictions as well too. And then as we move to step three, a commitment to reopening business and the community with minimal restrictions, but underpinned by COVID-safe ways of living. As we step through twos and threes, and in the lead up to that as well too, we'll be running legal updates and webinars, particularly covering off those areas. But obviously, the first step is preempting the first step as states continue to reopen. So some of the backgrounds around this from a legal drivers, which we have covered off, and you can go back and have a look at the previous webinars. I'm not going to cover these off in great detail today. Was previously, a lot of this is actually built off, obviously, the biosecurity legislation. You'll see me reference that when I talk about the COVID app and the obligation to require staff to mandatorily download that, and what the answering that question, whether you could actually get staff to mandatorily download the COVIDSafe app. But in saying that, there's also the omnibus legislation, and an example of that was what we covered off last week, which was around the week before, which was specifically around the emergency measures and also specific changes to legislation in terms of rollouts of where we are and what we're looking at the moment. And of course, overarching that is also the work health and safety obligations. And this is really where the COVIDSafe guidelines that we're going to talk about today come from your agency, as well as the director and officer legal compliance obligations as well. So let's have a look at the roadmap. The three-step framework for COVIDSafe Australia, and again, this is, you would have seen this already across the news and media. We've also loaded this into this session. You can download this document directly off the presentation slides already, and under the handout section, you can download this along with the Word version of the guidelines as well. So we're currently looking at step one, and we're going to cover off what this means and some of the legal compliance obligations around this. What the focus here is on is work gatherings, non-work gatherings of up to 10 people, up to 5 visitors at home, in addition to normal residents, working from home if it works for you and your employer, and also workplaces developing a COVID-safe plan and avoiding public transport in peak hour. Now, this is really one of the first points that we can see the workplaces developing a COVID-safe plan and what this actually means. Depending on where your agency sits, obviously right across to if you provide education and childcare services, if you also provide end-of-life services, particularly for some Aboriginal and community service organisations that we do support, particularly around funerals as well too. Again, these do provide you with some guidelines around directions for your specific alignment of your policies. One of the other items that we will draw your attention to is obviously domestic travel, which is on the far right-hand corner of this slide. In the past, when we've looked at the policy positions for agencies, we have specifically identified that agencies develop and mandate that they restrict the domestic travel unless specifically required. Obviously, this now starts to roll those measures back in terms of allowing local and regional travel for recreation, and also requiring agencies to refer to the state and territory governments for border restrictions and obviously biosecurity measures. So it's not completely open, but in terms of your policy position, this provides quite clear directions, quite clear broad directions around some of the lifting of restrictions. When we look at this, the first step is, and this is where we can start to have a look at what's changing. As I mentioned, things like 5 visitors at home, in 10 in business and public places, and also where and what your employee or staffing obligations are. That is, maintaining the 1.5 physical distancing, maintain hand hygiene, practice respiratory hygiene, staying home when sick. And I think it's really important when we start to look at the policy areas and also the WorkSafe obligations, that the role of employees is effectively also put in a policy position for your agency around this. Now, you'll see that one of these is around developing the COVID-safe plans for workplaces. And there has been considerable discussion in the last week around, well, what should this be and what should we look like? This is something that I'll cover off in the upcoming slides as well. So with it, one of the underlying key requirements that we're going to push across a lot of when we talk of the policies in both agency but also employee legal compliance obligations is effectively maintaining their role in this area of maintaining the physical distancing, hand hygiene, etc., in terms of what you need to look at. Now, in terms of the timelines as well too, Victoria effectively is introducing these as of 11:59 today. We've seen that South Australia has announced that it will do it on yesterday. Queensland on the 16th of May, with some restrictions being rolled between now and then. In terms of Tasmania, some phases of step 1 are already being introduced, and the rest then on Monday the 18th. New South Wales hasn't, as of hasn't currently made any changes, and the Northern Territory have already introduced some of the roadmaps, and Northern Territory doing things slightly different. But obviously, as key updates are being made, we'll actually inform your agency depending on where you sit and in what jurisdiction. A number of community service organisations also are spread both nationally and specifically up and down the east coast of Australia, and where that is, we'll actually provide you with clear directions on each of those, certainly over the next few weeks and months as things change as well. So in terms of the changes to the workplace, this is probably where we start to drill down into the COVIDSafe agency plan that your agency needs to consider. So there is the specific step 1 about reopening and commences with physical distancing and hygiene. As I mentioned, the 5 visitors to your home, gatherings of up to 10 people outside the home, obviously important for group classes and group sessions that you might have. Need to start to look at what that might look like in terms of social distancing for those services, and obviously libraries, community centres, playgrounds start to reopen. Now, as I mentioned, there has been discussions around and references to the COVIDSafe Plan for agencies, and agencies asking, well, what does this actually mean for me? And for you, what it means is, first of all, let's cover this from a work health and safety point of view. So as a director and as an officer of your agency, we include officers to be CEO, deputy CEOs, senior exec and senior managers, as well as any other nominated representative as well. Now, with that, if you are an officer, you need to exercise due diligence to ensure that your employees comply with their duties and obligations, and I'll come to what that is. In relation to the COVID-19 due diligence, it means you must acquire and keep your knowledge of the COVID-19 situation up to date. Obviously, following advice from authorities such as the Australian Government of Health, which most of you already do when we've spoken to yourselves and in emails we've seen from CEOs and the likes, and also check any updates around safety advice. It also means that if there is advice is relevant to your workplace, you actually quickly take the steps to help your agency implement it in your workplace. And to support you to do that, what we have done at Gemba is start to load in some of the return to work forms, COVID self-assessment forms, and also your COVIDSafe plan as well too for yourselves to actually use. What this will mean is that you will then see and be able to monitor your WHS hazards and risks, including how COVID-19 could affect your workplace and workers. And this is actually starting to become important. When I say starting to become important, we can see that WorkSafe and the COVIDSafe plan is focusing on the workplace and the workers, but it's really focusing on the monitor for yourselves to actually monitor that side of it and actually actively monitor that side of it. It also means that, and this is taken directly from WorkSafe as a regulator as well too, to make sure your workplace is properly resourced to manage the WHS risks during the COVID-19 outbreak and check that those resources are being used. Now, with it also goes on to require business policies, procedures and reporting to ensure that they address the risks of COVID-19 and also ensure that communications are made directly with your employees. And this is really part of the COVIDSafe plan that your agency needs to look at in terms of people returning to work. So you have this 3-step plan that the Commonwealth has in fact offered. In order to put that into practice, what will be required is this COVIDSafe plan, to then take those key requirements and put it into a working policy procedure and document for your agency to actually use. Now, when we look at the ensuring policies from a legal compliance point of view, what is important is that these 4 areas around some of the WorkSafe requirements, and this will go to the heart of your COVIDSafe Plan requirements. And we'll send these slides are made available as well too, along with the other Gemba 360 resources as well. So you can have access to all of this information that I'm showing you right now. So part of that COVIDSafe Plan is to look at filling out risk assessment templates for hazards arising out of COVID-19, and part of that is around your daily assessment forms, having procedures for consulting with workers. I will come back to this, particularly around mental health that's coming up, family violence issues that's also being reported, and also developing a process for how your agency will respond if there is a case of obviously COVID-19 in your workplace. There is the infographic which you can utilize as well too. If there is resources out there, such as from WorkSafe and the likes, we will share those with you obviously, and you can access those as well. Also developing or updating a policy for working from home, including on how to set up these safe work spaces, and many of you have already done that. Now you're looking at pulling that information back and monitoring the transition back to the workplace. So these are really some of the key 4-step points from a COVIDSafe Plan to actually have in place for now this 3-stage process. And keep in mind, as this 3-stage process now starts to be unpacked, starting with these first 4 points will allow you to actually step that through. We have been asked by agencies, do we have to do this whole COVIDSafe Plan all in one go, or can we just effectively step this through part by part? Our response has been take a staged approach. Don't try and do all 3 stages all at once. Effectively do a stage-by-stage approach because things may change equally as well too. So one of the other questions that agencies have asked us is that while planning for staff to return to work, can we as an employer have a mandatory requirement for staff to download the COVID app? Now, if you remember, obviously the COVID app was to help Commonwealth or the chief medical officers and the likes to actually, from a public health point of view, to be able to undertake their staff to undertake tracing in the event that there is a second wave outbreak or people have come in contact with someone with COVID-19. So effectively, when we've had a look at the biosecurity legislation, effectively section 9(1) of the biosecurity legislation provides that a person must not require another person to download the COVIDSafe to a telecommunication device or have the COVIDSafe in operation on a telecommunication device, or consent to uploading app data from a mobile device to the National COVIDSafe data store. So effectively, while it is being made voluntary, employers can't effectively require or make it mandatory that staff, as part of their employment, actually download the COVIDSafe app to their phone. With it, we've had a number of agencies actually ask us this particular question around this, and it is something that we wanted to mention here. Subsection 9(2) as well too, which I will just mention, provides that a person must not refuse to enter into or continue a contract or arrangement with another person, including a contract of employment, because they haven't effectively done it. What this means is that while your agency may encourage your employees to download or use the COVIDSafe app, they cannot direct employees to download it or either on a personal device or on a mobile device provided by your agency for business use. So it is something to be aware of. A number of agencies have asked us this question over the last few weeks, hence the reason that we're actually putting it on these slides. So what have agencies actually done? A number of agencies have used the daily COVID-19 form that is on your dashboard and require staff to actually complete it in order to provide that WHS and screening requirements as well. This has been done very successfully and meets work health and safety requirements, public health requirements, and also fair work legal obligations, because under the biosecurity legislation, it talks about specifically the COVIDSafe app. It doesn't talk about any other sort of form that you may require staff to complete on it. Now, one of the other parts that I will just go back to as well too is around the employees' obligations as well too, and it's something that your agency should be aware of. So again, this was taken from Safe Work. It's an infographic taken from Safe Work Australia. So while we talk about duties of directors and officers, where there are also for employees and other staff, there is also obligations that they need to follow as part of the COVIDSafe Plan, and they need to be included in the COVIDSafe Plan as well too. So with it, as part of this, if they do display symptoms, or they want to seek advice, or they need transport, etc., or managing the cleanliness as well, then they too need to abide by safe work practices as well too. And effectively, this infographic really covers that off. We will be circulating all of this material around today with today's slides, and also copy of the webinar as well too for your use within your agency. So again, from a policy point of view, it's actually important, and many agencies have started to put these up in the workplace ahead of people returning to work, because effectively it really spells out very clearly what an employee's obligations actually are as well. In the past, we have had situations where agencies have contacted us and actually raised the question, what to do if somebody displays the symptoms. Can you mandatorily require them to isolate until testing occurs? And effectively following this infographic spells that out clearly of what the employee's obligations actually are as well too. And this is now obviously includes not just, as we mentioned, COVID symptoms for COVID-19, but also staying at home if they're unwell, and asking for things like doctor's certificates and the likes is what you can also require from them if you need to as well, if that's part of your policy. So with it, let's go through some of the work health and safety obligations. So with it, under your COVIDSafe Plan, what you'll need to look at is your duties under the work health and safety obligations as well too. So this was taken directly from the work health and safety site around this. We are tailoring it to specific community service requirements as well. So again, let's just remind you that WHS laws require you to take care of health, safety and welfare of your workers, including yourself and other staff, contractors, volunteers, and others, including your clients, or if you call them patients, customers, and visitors to your workplace. Now, part of that is that the workers' rights to stop work has also been raised. And in some circumstances, workers or the health safety reps have the right to refuse to carry out or stop unsafe work practices. Again, if it is within the policy document, you really need to look at what those examples may be. But it's really around exposure to serious risk or to their health and safety, or obviously from an immediate or imminent hazard as well too. Under WorkSafe, this could include exposure to the COVID-19 virus, obviously with some essential workers and front of house staff as well too. This exposure, I'd say, should have already been managed around this, but obviously as specific services start to, or program areas start to reopen, you may need to consider specific sites that may not have been exposed to the COVID-19 virus, and also conduct your site audits. And I'll actually show you what the site audit requirements are, again, from the work health and safety obligations as well. One of the other parts is around identifying vulnerable workers, especially for some people who are at greater risk of more serious illness with COVID-19. I'm going to say this does become more complicated for some agencies, especially agencies that either provide services to these particular vulnerable groups, or those agencies that are already within these vulnerable groups. And clearly an example of that is an Aboriginal and Torres Strait Islander corporations that actually are run by Aboriginal and community service groups, and also people that fit into the 65 years and older that have chronic conditions, or 70 years and older, and people with a compromised immune system. Now, for agencies that either have staff that are fit into these vulnerable workers, you do actually have an obligation as part of your COVIDSafe plan, and part of this three-stage process is to actually screen these staff and provide support programs for these staff as well. Now, one of the questions that's going to come up is, how do I know what is reasonably practicable to manage the risk of a vulnerable person contracting COVID-19? So let me be quite clear about something to start with. You cannot discriminate against the people that may fit into this group by excluding them from the workplace because they are a vulnerable group, standing them down, or alternatively ceasing contracts and the likes purely on the basis that they are a vulnerable worker. What you do need to look at is what is reasonably practicable to manage the risks of a vulnerable person contracting COVID-19. So, and reasonably practicable, which many of you would know, is a term that's used under the work health and safety legislation. And this is going to be part of your legal obligations as we step through these three stages, or three steps. So deciding what is reasonably practicable to protect workers or other persons from harm requires taking into account and weighing up relevant matters, including the degree of harm that is likely to occur if the risk of contracting COVID-19 eventuates. Now, what we mean by that is, if a vulnerable person contracts COVID-19 or the coronavirus, it can result in serious illness or death, which means the degree of harm that might result from the risk or hazard is actually very, very high. So as part of this, from an employer's point of view, if you're a compliance officer or quality officer or work in HR, or considered to be, and I just use those as examples, particularly in the quality space, equally if there is, so that way with it, if there is, and I can just see another question come through where I've just mentioned that staff cannot hot desk. We've just had a question in which I'll come to in a minute about hot desking. So with it, in terms of your screening, you must consider all available control measures to limit the exposure to a vulnerable person, even if the likelihood of them contracting the coronavirus may be low. This includes whether they can work from home in their usual or other role. So with it, one of the areas is looking at what is the role that they actually play, what services do they, or what programs are they actually involved in, and also how you actually manage these risks. Now, part of that will vary depending on both the type of agency that you work in, whether you're providing outreach services, what control measures is reasonably practicable to actually put in place as they return from home, and whether they continue to work from home during this period of time. And so there are a number of public health variables that you need to consider. So with it, part of that is that these, in May, Safe Work Australia has reissued its guidelines on how to manage work health and safety risks, and one of that is around conducting the screening, which we have also loaded onto the Gemba dashboard for you to use. We have had a question just come through in relation to around the work health and safety obligations from one of the exec managers down in Victoria, just asking, I read somewhere that staff cannot hot desk. Is this correct? Hot desks are usually shared spaces where staff might come in and actually utilise that. I'll have to take that on notice and come back to you and the group on that. Look, we'd have to check what the requirements are. Straight off the top, haven't seen that at this stage. It is covered around some of the work health and safety around cleaning and disinfecting of workstations. But in saying that, let me come back to you, and any questions that we need to go back and check in this case, we will circulate out to the group as well too. But thank you for that question. One of the things that have come up from the work health and safety and the COVID-19 plan is around what I can do to keep my work safe at the workplace and limit the spread of the coronavirus. And there is a checklist that WorkSafe have provided, and they have recently updated this as well too and reissued it. This covers a number of areas, including what you need to do from working from home, physical distancing, hand washing and hygiene, cleaning, monitoring symptoms, and also things like planning ahead. With it, this particular form should really be used across your different sites as well too. Some agencies have asked us, how often do we need to screen or use this to screen? It depends on obviously the spread of the staff that you or access to that particular site and the likes, and also requirements that you might have in terms of how many staff actually utilize the site as well. So we have also loaded this resource onto Gemba for you as well too, and that's on your dashboard should you require it. But it effectively gives you the checklist of some of the items that you need to look at in terms of cleaning, and it does cover things like, e.g. visitors to your premises are cleaned at least daily with detergent or disinfectant and the likes. And any frequently touched areas are also then cleaned down, including personal property that comes into work, such as mobile phones and the likes. So with it, it is a checklist, again, from a COVIDSafe plan to actually introduce into your agency. So effectively down in Victoria, what we have got is groups of no more than 10 can now participate in outdoor activities. However, there's no camping or overnight stays that are allowed. Weddings are up to 10 guests, and 20 people will be able to attend funerals that are held indoors, and up to 30 if they're outdoors. Counselling services will be allowed with groups of no more than 10, as are worship or religious ceremonies. And all of these requirements will effectively come into place on to 11:59 tonight, and also will be reviewed on Sunday, the 31st of May. Now, with it, part of that is that they've also said, which I raised from a policy when we start to look at your policies for your agencies. Part of that is that even the state premiers, whether it be down in Victoria, up in Queensland or New South Wales, have asked people to use their judgment, and the advice is just because you can doesn't mean that you always should. And part of this, from a legal compliance point of view, gives your agency some discretion to do the same. So with part of this, and why I put these in, especially around these directions that are coming up, is that where effectively the premiers or parliament are saying for people to use their judgment around this, it means then that when we're looking at your COVID-safe plans, when we're looking at some of your policies that need to be varied and changed, the judgment rule means that there gives us some flexibility for your agency to start to look at similar wording as well too, because effectively some of the judgments that you may need to have is to make sure that you meet your work health and safety obligations, and providing a bit more of direction if that's what your agency requires, and it may change, would really allow you to do that. And again, we keep in line with the reviews that should occur on the 31st of May or 1st of June, again after policy positions may be changed by Parliament as well too. Now, a couple of other housekeeping things I did also want to mention was around the rules for tenancies, and this does affect a number of agencies and also clients and services that you support. So with it, if you remember in previous sessions, we've actually covered off, and I've just taken this slide out from here, is that there has been an extension for a 6-month period around moratorium for evictions for residential and commercial tenants, and there was also a code of conduct that was issued thereafter. And again, if you want further information, by all means, go back and have a look at the previous webinar resources as well. As part of that, the reason I bring this up is that even with these stages and with the rolls back, doesn't mean that these tenancy rules effectively are also rolled back as well too. Any agreements that you've made or that your agency's made for on behalf of clients, or your agency may be involved in some of these as a partner or party to this, equally is that these will still continue as well. And it's important to be aware of that. So with it, these national changes and codes of conduct that were there effectively is still written over and across the 3 stages, and nothing has changed in that space in regards to this, which is important to be aware about. Now, one of the health impacts that I also wanted to cover off in looking at your COVIDSafe plan is the health impact on the pandemic. And what I mean by that, and I was hesitant to use this slide, which talks about the pandemic's pandemic. And what I mean by this is that when we talk of the COVIDSafe plan, effectively, while there is a reduction and rollback in terms of the restrictions in place, one of the things that your agency really needs to be carefully considering is, and when I say the pandemic's pandemic, is the accounting of the rise in mental health issues, the rise in family violence, and the need for supporting challenges, be that to your staff or also your clients as well. And particularly in the workplace, when I talk about the pandemic's pandemic, and I hesitated in putting this slide up yesterday when we spoke about it, was because on one hand, there is much talk about flattening the curve, which obviously all of us are pleased to see. However, one of the other items that we do need to carefully consider from a public health but also a legal compliance obligation is to look at your COVIDSafe plan in relation to the prevalence of mental health impact to your staff, the potential rise in family violence and challenges as well too, and also support challenges in implementation of the COVIDSafe plan, and ensuring that your COVIDSafe plan has capacity to actually identify these particular areas. A number of agencies have already, as part of their work health and safety requirements, have actually started to assist staff by starting a simple screening process to look at potential prevalence of mental health issues. I raised this within their own prevalence of mental health issues within their own workplace as a direct result of the coronavirus, and it is something that people are actually raising. It will mean that in terms of your business continuity plan, your COVIDSafe plan, last thing you also want to have is for staff from an HR point of view as well too, staff effectively not being supported, and the fallout for your workforce and capacity to provide services to staff is not being addressed, because effectively a number of staff are effectively going off on things like stress leave or the likes because of that lack of relationship support or capability to address mental health challenges that they might have. So some of the COVID-safe areas that I'm talking about is to really include key performance indicators within your COVID-safe plan around relationship needs, mental health, mental needs, and physical needs as well too. And effectively looking at these particular criteria would actually support that process as well. Some of the other legal drivers which I will mention, which we've spoken about already in the past, is around the biosecurity and omnibus legislation. There is the, obviously, which many of you have rolled out, the new workplace reality is around elastic digital services, which many of you will continue to use as part of your COVID-safe plan as well too, looking at not just cultural awareness, but obviously continuing the virtual work from home environment. Things like security and document management is now becoming a major ongoing challenge for agency as part of that process. And again, it's something that we raise with you as one of our Agenda 360 clients as part of this ability for you to utilize some of these services as well. So with it on your Agenda 360 dashboard, which I will just mention, and we will finish off shortly and open up the phone lines for any questions, is the ability to actually look at specific checklists that your agency has and also dashboard requirements. Now, within this, what you can see is that you do have your WorkSafe plan that you can effectively do your audits. You also do have access to your COVID-safe plan, and you can see that here where this allows you to effectively, which we have already pre-populated for you, to look at your COVID-safe plan requirements, key requirements across each of the stages, looking at basic details, indicator sets, and also milestones that your agency can also report and also assign to staff to complete as well. So it allows you that you already have access to a lot of these resources to support your COVID-safe plan implementation as well. In terms of agency policy positions, there has in the past, going back, and February does seem a long way away from where we are right now. It was introduced as part of a mandatory vaccination bill at that time. A legal update was also sent round where it was making vaccinations mandatory for healthcare workers, and that was issued back in February 2020. As I mentioned, February seems a very, very long time ago. As part of that, new laws at the time was to protect health workers. Again, from a policy position, we just remind you around that, and also the position was from the state government, and it's been reconfirmed by the Chief Medical Officer a number of weeks ago when we ran previous webinars, was that workers who refuse to be vaccinated may face work restrictions or be redeployed to other parts of the health service as well. So equally, it is important just to be across those previous requirements. With it, as part of that, and this applies in other states and territories as well, as part of that, what we have suggested is that you align your policies quite simply to the community directions under Step 3. You look at the WorkSafe practices and policies. We have summarised many of those in today's session, We will be circulating all of those together with the Fair Work guidelines for your agency, and also look at conducting the site-based audit for the Safe Work guidelines prior to staff actually commencing back, or the full staff commencing back as part of the redeployment from home, working from home. Some agencies have looked at a EAP, Employee Assistance Program, and that's part of the screening for mental health and wellbeing services. Again, that is something that many agencies already have in place. So really what we are looking at is updating your policies, looking at the COVIDSafe Plan. We've covered off, there's a lot that has been covered off today, particularly around the topical areas for the COVIDSafe Plan requirements and the WorkSafe requirements, and also key policy areas for your agency to look at. With that, we will open up the phone lines and stay on the line to answer any questions that people might have. Obviously, if there are questions that come out of today or even after today's session, you can contact us on 1300 360 360 or email us at support@gemba360.com.